welcome. If you're gearing up for your NHA certified phlebotomy technician exam, you already know how critical it is to nail the capillary puncture. So in this explainer, we're going to break down every single step, focusing on the precision, the safety, and the knowledge you need, not just to pass that test, but to give your patients the best care possible. Let's get right into it. So let's start with a basic question. What really separates just a regular fingerstick from a perfect one? Well, it all comes down to a technique that's so precise, it gives you a clean, high-quality sample every single time. And that's what ensures the lab data is reliable, which means the patient's diagnosis is accurate. That's our goal today. You know, at its core, the capillary puncture is a fundamental phlebotomy skill. We use it all the time for point-of-care testing or, when a full venous draw just isn't the right choice. But don't let that term small volume fool you. The potential for errors is actually huge, which is exactly why getting this technique down pat is so crucial for good patient care. A perfect puncture really begins way before a lancet even comes out of the package. So let's start with phase 1. Preparation. This is where your attention to detail is going to prevent the most common and the most critical errors that you're likely to see on your exam. Think of this 4-step sequence as your pre-flight checklist. Seriously, before you even think about your equipment, you have to verify the patient's identity. And that means using at least 2 identifiers, like their full name and date of birth, and matching them to the order. Then you confirm the test is even appropriate for a capillary draw. After that, you'll explain the procedure, get their consent, and of course, perform hand hygiene before gloving up. And this right here, this is a huge NHA exam alert. It highlights a major point of failure. If you find any kind of mismatch, a name spelled wrong, a missing birth date, an order that just doesn't seem right, you have to stop. You don't proceed. Your job is to get that issue resolved with a nurse or a doctor before you draw. Never, ever just guess. Okay, site selection. This is a massive topic on the CPT exam, and this table really lays out the non-negotiable rules. So for anyone over a year old, you're going to aim for the fleshy pad of the middle or ring finger, a little off center. That's where blood flow is best. A key thing to remember is to avoid the same side as a prior mastectomy because of the risk of lymphostasis. That's fluid buildup, which can really skew the results. And it's an absolute no-go to puncture a newborn's finger. The risk of hitting bone and causing a serious infection called osteomyelitis is just too high. Take a second to let these rules really sink in. So after you've cleaned the site with 70% isopropyl alcohol, you have to, and I mean have to, let it air dry. All on its own, don't fan it, don't blow on it, don't wipe it. Why? Well, first, it'll sting the patient if it's still wet. But even more important, any leftover alcohol can contaminate that sample and cause hemolysis. That's when red blood cells rupture, which is a one-way ticket to a rejected specimen. All right, now we get to the most technically demanding part, getting that perfect, beautiful, free-flowing drop of blood. This is really where your hands-on skill is going to shine. Okay, here's your play-by-play. First, you're going to firmly but gently hold the patient's finger still. Second, you make one single decisive puncture perpendicular to the fingerprint lines, and then immediately, and I mean immediately, dispose of that lancet in the sharps container. Third, and this is a critical step you can't forget, you always wipe away that very first drop of blood. Then you're ready to collect your sample from the nice round drops that follow. This is probably the most common mistake people make, both out in the field and on the exam. You never, ever squeeze or milk the finger. When you do that, you're pushing tissue fluid into the blood, which dilutes the sample and causes hemolysis. So what do you do instead? You apply gentle, intermittent pressure to the area just before the puncture site, so closer to the hand. That's going to help a good drop of blood form naturally. Yep, just like with venipuncture, there's a special order of draw for capillary collections that you just have to memorize. Think about it. The second the skin is broken, the blood starts clotting. So you always have to collect your blood smears and any EDTA tubes first to keep those platelets from clumping up. Serum tubes, which actually need the blood to clot, are always going to be last. You know, when you're filling those little microtubes, precision is absolutely key. The amount of blood and the amount of additive inside have a very specific ratio. If you underfill or overfill it, that ratio gets thrown off, and that can lead to wrong results and a rejected sample. And as soon as you cap it, you need to mix it right away by gently inverting it about 8 to 10 times. Just remember, never shake it. Shaking can also cause hemolysis. All right, you've got your sample, but you're not done yet. Let's talk about the final phase, the safe finish. What you do after the collection is just as important for patient safety and for making sure that sample is viable. So your last two major responsibilities are getting the bleeding to stop and labeling that specimen. You're going to apply gentle pressure with a clean piece of gauze until it stops completely. And at the same time, you have to label the tube right there, at the bedside with the patient right in front of you, because an unlabeled or mislabeled tube is completely useless, and any mistake means you have to put the patient through the whole thing all over again. Now, this one is an absolute, non-negotiable safety rule straight from OSHA. The second that safety lancet is used, it goes directly into a puncture-resistant sharps container. Don't put it down, don't try to mess with it, straight into the sharps bin. This is all about protecting you and everyone else from an accidental needle stick. Okay, let's do a quick review of the absolute must-know facts for your NHA exam. You can think of these next few slides as your high-yield, gotta-know-it flashcards. For an infant heel stick, you have to burn this number into your brain. The maximum puncture depth is 2.0 millimeters. If you go any deeper, you run the risk of hitting the heel bone, which, as we said, can cause that really serious infection, osteomyelitis. And here's another critical number for you. Let's say a patient's hands are cold and you need to warm them up to get better blood flow. If you use a warming device, its temperature can never, ever go above 42 degrees Celsius, which is about 108 degrees Fahrenheit. Any hotter, and you risk burning the patient. At the end of the day, this is your simple formula for success. If you can just remember this, you'll be on the right track. Proper aseptic prep, a good stable hold, and gentle pressure. That's the combination that gets you a high-quality hemolysis-free sample, which leads to accurate, reliable lab data. So why do we obsess over all these little details? It's because your skill, your attention, your commitment to doing it right every single time, it directly affects a person's health. A rejected sample means a delayed diagnosis. It means more stress for the patient. It means they have to go through another painful procedure. Your technique is literally the crucial link between that patient and their diagnosis. So be precise, be professional, and you're going to be an amazing phlebotomist.